Hi, Sherry. How are you?
I'm doing great, Dr. Nelson. It is so good to see you.
Very good to see you. Thank you for coming again.
I am so excited to see how you can help me.
Great. Tell me a little bit about what's going on. What do you want help with?
Well, as you know, I'm a believer in holistic nutrition.
Right.
And you are the holistic nutrition guru.
Thank you very much. I appreciate that.
And I've been noticing that I am not feeling up to par.
Okay.
And I know that when you're not feeling your absolute best, a lot of it has to do with how your body is reacting to the foods that you eat.
Okay.
And even though I am a very healthy person and I eat organically, something's off kilter. And I'm wondering if you can help figure out what that is and what's going on.
Absolutely. So when you say something is off kilter, are you experiencing difficulty when you eat particular foods, or are you low energy?
I am low energy.
Okay.
I've noticed that, and I've noticed some changes where my hair isn't quite as vibrant as it should be. It's a little bit dry right now.
Okay.
I've noticed that the texture has changed. It's looking a little bit thin in some areas, even though I go to my hairdresser on a regular basis.
Right.
And I'm cold all the time.
Oh.
And I know it's winter and it's been very, very cold.
Very, very, very cold here lately.
But
one of the coldest places in the country right now.
But
11 degrees this morning here in Atlanta, Georgia.
No, I know. And even though I sleep 7 hours a night, I get 7 hours sleep all the time. I mean, and I get very restful sleep. Nelson, honestly, I could fall asleep right here, right now if I wanted to.
Not good for a woman by the name of ShariFitness.
No!
Our local celebrity here. Sherry, let me tell you a few things. One of the things that people, women in particular, interestingly enough, I don't get a lot of men that ask me this, but women will often behind closed doors say, Dr. Bormash, what can I do to make myself look better? I'm in my 40s now, I'm in my 50s, I'm in my 60s, and I'm not quite as lovely physically as I want to be. So one of the things that I teach people is that true beauty, and right now I'm making it a given that beauty also has to include a beautiful personality and a beautiful nature and so forth. But physically speaking, real beauty is created from the inside out, not the outside in. You can do every wonderful hair care, skin care product on TV that you see advertised. It's not going to be effective if you're not doing the right things internally.
I understand.
Does that make sense to you?
That makes perfect sense, and again, that goes back to what is it you do that I think you can help me, and a lot of people don't know about this.
No, you're absolutely right.
Is nutritional testing.
Yeah, very, very true. So let me say just a few things before we get started.
Sure.
First of all, I'm going to use something called kinesiology. It's a form of muscle testing. Sherry, you and I have worked together for some time now. One of the things that you've experienced is you've experienced my soft tissue work, you've experienced my chiropractic work. And you've, I'm guessing, found that to be pretty effective in getting you to function.
Yes.
Much better, right? Your workouts are better, you probably have less joint pain, you can probably push harder in your workouts, I'm guessing.
Yep, had some personal bests.
Yeah, fantastic. But what I'm hearing is that there might be something that's still kind of unresolved, meaning there's some kind of deficiency internally that's not allowing you to express physiologically so that you feel fully alive and vibrant. Am I hearing that correctly?
You are hearing that very correctly.
I hear it from a lot of people. So here's what we're going to do. In a moment, I'm going to have you lie down. I'm going to stand up, and I'm going to do a form of bioenergetic testing, okay, called kinesiology. And what we're going to do is we're going to look for weak reflex points. One of the things that I'm already listening for when I hear you speak, your energy's a little low, you have some cold intolerance on this 11-degree day here in Atlanta, Georgia, a little shocking to us.
Yes.
Maybe not those of you in Barrow, Alaska, but here in Atlanta, we're not used to 11 degrees.
Yes, but the thing is, I'm originally from New York City. We're used to winter. You.
I know, from Michigan.
He's from Michigan.
Yeah, what are you going to do? Yeah.
Cold is cold.
Cold is cold. Yep. So what we're going to do is we're going to scan the body to see which reflex points are weak. And those reflex points are going to be associated with organs and glands. Okay? Then we're going to find out which is the weakest of the weak and why it's weak and what we can do about it.
Sounds great.
Okay.
Let's get it going.
Let's get it going. Please, here, Sherry, lie face down here.
Alrighty, we'll do.
Great. So Sherry, have you ever had anybody do kinesiological work with you before?
No, you're the only one.
Okay, good. Very, very good. So let me explain some basic things. Number one, what's very important is that we can rely on our muscle testing. If it can't rely on the muscle testing, then you don't have any way of knowing whether your tests are adequate, okay, or accurate.
Okay.
I'm going to have you essentially keep your elbow locked,
Okay.
keep your arms slightly below 90 degrees,
Okay.
and I'm going to say hold or match my pressure.
Okay.
And I want you to do just that, okay?
Okay.
So you're going to hold, please, push against me, and hold. Do you feel that?
Yeah.
That's called an arm lock.
Yeah.
I'm not interested in you embarrassing me by pushing my arm down.
Right.
I just need to know that I have an arm lock that I can count on when I muscle test you, okay?
Okay.
All right, so let's do it again. Hold and match my pressure. Very, very, very good. Now what I'm going to do is I'm just going to do some quick tests neurologically to make sure I can test you. Hold, please, and hold. Good. This is a calibration test. Do you feel how much harder that is?
God, yes.
It's a very simple way that I can get a positive for this is a good lock. Hold, okay? This is a failure to lock.
Yes.
That's important. It tells you and it tells me what a positive test is and a negative test, okay? Now, I'm going to find your belly button here. Going to do another test. Hold, please. Good. That test is supposed to be weak, okay?
Okay.
It's a test for the nervous system to make sure, once again, that the nervous system is working right. Go tip to tip, just like this. Can you?
Oh.
There you go. Very good. And hold. Nice. That's strong and it's supposed to be. The same thing here. Okay, and hold. Hold, real hard, hold. Good, very good. Relax that. So these 4 tests indicate that you're testable. And that there's nothing that I immediately need to attend to other than our next step, which is to find which reflex points are weak. Okay, Sherry? All right, so we're going to start by scanning the head. Hold right here. Good, very good. Hold. Lift your head up a little bit here. Thank you, Sherry. And hold. Great. Relax. Sherry, please close your eyes if you would. Good. Sherry, what did you notice there?
Yeah, as soon as you hit my thyroid,
Right.
I went weak.
Yeah. So let me say something here first of all. What we're doing is functional bioenergetic work. We're not here to cure anything. We're not here to treat anything. What we're looking at is what's weak, why might it be weak, what we can do to give the body the nutrition that it needs to work in an idealized manner. Do you understand?
Gotcha.
So I'm not trying to treat hypothyroidism or whatever other conditions you may or may not have. We're looking at making the body function better, okay, by giving it what it needs. Does that make sense?
That makes sense.
Okay, good. So I'm going to scan here, the lung fields. Good, good. Sherry, put your hand right over your heart for me, if you would, with this hand. Yeah, thank you. And hold. Very good. Take your hand off the body, put it here by the side. I'm going to scan the side of your rib cage here. And hold, and hold. A little weak there, not as weak as the thyroid. That's liver.
Okay.
Indicates there might be a little liver stress. Oh, what's that?
Kidney.
Actually, kidneys weren't too bad, but there are glands that rest just on top of each kidney, called adrenal glands.
Ah.
And it's very, very interesting how many people that push as hard as you
Yes.
and me, for example, have adrenal glands that are stressed because, in part, we push so hard in the gym. Right? And so the body doesn't care. Stress is stress is stress to the body. Doesn't matter if it's a hard workout, doesn't matter if you're getting married, whether someone that you love died, stress is stress is stress to the body.
So you're telling me I potentially have elevated cortisol levels?
Possibly. And you know what we could do if we really wanted to answer that is we could do a saliva test and actually graph out your cortisol levels to see. They may be normal. You may be missing some critical things. Sometimes it's simple as water. Sometimes people need salt. And they may perk right up again. So, but if we need to, we can always do blood, urinary testing, salivary testing, you know, whatever other format we need to go to make sure that we're getting a complete background of what's going on in your body. Okay? All right. So here's the thing. What do we have? We have a little bit of weakness of the thyroid, a little bit of weakness of the liver, and a little bit of weakness of the adrenal glands. Okay? You know that in one way or the other, all three of them are related to energy. You can't be as perky as you want to be and be tolerant to cold like it is today if your thyroid isn't working.
Correct.
Well, the same thing is true if your adrenals aren't working because they sort of set the the level of energy that the thyroid will be able to actually burn energy, whether it be carbohydrates, fats, or proteins. They really help to set that rate, because if your adrenals are too weak, no matter how healthy your thyroid is, the thyroid is not going to be able to work at the level that it needs to. Does that make sense?
That makes sense, and that may explain why, regardless of as clean as I eat and how I do all the nutrient timing and exercise regularly, well, to the average person, I mean, I'm fine, but I know, for me personally,
Yeah, you're not playing at the top of your game.
I know I'm not.
Got it. All right, so now what we're going to do is we're going to see which, I'm going to put your hand in a particular position here. Now we're going to go up here. Is this strong or weak?
That side is a little bit stronger than when you were on the other side.
Right, okay. Now hold that hand position. Strong or weak?
That's stronger.
Yeah, that's right. Now hold.
Ooh.
So this is a great example. So what's happening is you're a woman that pushes very, very, very hard.
Mm-hmm.
Okay? So what we might need to do is simply improve significantly the function of the adrenal glands, and your thyroid might be perfectly fine. Okay? See that very frequently. So here's what we're going to do. You relax your hand.
Okay.
What we're going to do is we're going to look at how we can make all of these stronger. So
Okay.
the adrenals, primary. We're also going to look at the liver and the thyroid function. Now,
Here. Actually, I'm going to pause this.
okay, good.